Okay, we're going to talk about a health issue that is just so incredibly common, but for some reason we just don't talk about it. It's something millions of women are going through, a lot of them just suffering in silence, thinking they're totally alone in this. So, let me just ask you this, straight up, have you ever been there? You know that moment you cough or sneeze, or maybe you laugh a little too hard, or lift something heavy, and there's that tiny little leak. It's a moment so many women recognize, but almost nobody talks about. If that sounds familiar at all, I want you to look at this number. 2 out of every 10 women. You are so far from being alone. This thing, which is called urinary incontinence, isn't some rare, isolated issue. It's a really shared experience. But here's the real problem, right? So many women just think, oh, this is just a normal part of getting older. Or, well, I had kids. This is just how it is now. And because it feels embarrassing, or because of that misunderstanding, they never, ever ask for help. They just learn to live with it. So why? Why does this actually happen? Let's get into it, because understanding the cause is the first step. And I want to be really clear. This has nothing to do with some kind of personal failing. It's a mechanical issue, and it's all about a very specific group of muscles. Let's talk about your pelvic floor. The easiest way to think about it is like a muscular hammock, kind of stretched across the base of your pelvis. Its big job is to hold up organs like your bladder, and this is the key part, control the flow of urine. Here's a little trick to find them. Next time you're using the bathroom, try to stop your stream mid-flow. The muscles you just squeezed, those are your pelvic floor muscles. And this right here, this breaks it down perfectly. See, when those muscles are strong and toned, they keep everything supported and closed off, preventing any leaks. But when they get weak, that whole support system starts to fail. That little valve doesn't close as tightly. So any extra pressure, a cough, a jump, a laugh, can be enough to cause a leak. Okay, so what makes these muscles weak in the first place? Well, it turns out there are some pretty common life events and even daily habits that can really put a strain on your pelvic floor. Childbirth is, of course, a big one. I mean, the whole process can naturally stretch and weaken these muscles. And it makes sense that obesity adds this constant downward pressure. But look at the other things here. Stuff like diabetes, chronic smoking, and even drinking a lot of coffee can contribute over time, either by weakening the muscles or by irritating the bladder itself. And here's something really important to understand. Just ignoring it and hoping it goes away, that doesn't work. In fact, it's usually the opposite. This is often a progressive condition, meaning what starts as a tiny, minor annoyance can grow into a much bigger problem that really starts to impact your daily life if you don't address it. But, and this is the most important part of this whole conversation, there is really, really good news here. Let's shift gears and talk about solutions, because treatment isn't just possible. It's often way simpler than you think. This is the key. This is what doctors want you to know. If you catch it early, the path to getting better is often very straightforward. All the power is in just taking that first step and doing it on time. So what does that path look like? Well, step 1, always, is to talk to a doctor and get a real diagnosis. After that, the most common treatments don't involve anything invasive. You've probably heard of Kegel exercises, right? They're basically targeted workouts just for strengthening those pelvic floor muscles. And then there's bladder training, which is about setting up a schedule to help your bladder learn to hold on a little longer. Now, for cases that are a bit more stubborn or severe, there are other options. A doctor might suggest certain medications that help calm down an overactive bladder, and in some situations, a surgical procedure to add more support might be the best route. And that's exactly why getting checked out early is so important. Okay, let's wrap this up by talking about the single biggest thing that stops women from getting help. And it's not the exercises or their doctor visits, it's shame. Let me just say this as clearly as I can. Dealing with urinary incontinence is not some kind of character flaw. It's not a sign that you're not clean, and it is absolutely 100% nothing to be embarrassed about. It's a medical condition, that's it. Pure and simple. Just like having high blood pressure is a medical condition or arthritis is a medical condition, it has physical causes. And, like we just saw, it has effective solutions that are totally within reach. So I'll just leave you with this question to think about. When there's real, effective help out there waiting for you, why would we let silence or embarrassment stand in the way? Really, what could possibly be more important than taking back control and putting your own health and well-being first?